My name is Victoria Achut. I'm a medical doctor, Australian South Sudanese. I've trained in Australia. I've done my internship in Modbury Teaching Hospital, worked a few years at Modbury and work in country Aubrey Wodonga as a trainee GP. And after the independence of South Sudan, I decided to go back to the country and help. I've been in South Sudan for the last few years, and I'm really appreciating and acknowledging the work done by Fulcrum Aid in my country. I think the work you guys are doing is eminent and paramount and need to be acknowledged. I work in the Ministry of Health at the national level as a HIV director, so I run the HIV program across the country, overseeing prevention of mother-to-child transmission, PMTCT, and VCT, which is voluntary testing and counseling, and also ART, which is antiretroviral therapy, providing treatment for HIV patients. And I was very privileged to have known Steve for the last maybe 7 years since I was in Adelaide. And I think it will be, I know people think South Sudan, there is war in South Sudan, there's insecurity and instability, but I would really like to reassure everybody that it's not all parts of South Sudan. I lived in the country for the last 6 years and I've been safe. Places like Rumbek and Yorul and some parts of the Equatoria are safe and people are doing hard work there. I think things that the country needs is human resource development in health, which is really good and vital. So training of medical personnel, training of nurses, training of midwives, training of doctors, training of public health practitioners is really important. Things like scholarships and exchange programs or fellowship programs are really important, and the country can't afford to send staff to places like Australia and other places to train. So help in that particular area will be really good. Medical equipments. The medical equipments is a big challenge in South Sudan. Some hospitals are lacking simple things like pulse oximeters, an ECG machine, a cardiac monitor, for instance. Digital x-rays are not there. There is no CT scan. Only one private hospital has a CT scan in the whole country, which is a shame. So medical equipments that can be donated or has used and not people who don't need them anymore will be really of help. And we are happy to facilitate and coordinate with the Ministry of Health at the national level as well as the State Ministry of Health. For example, Rumbek State, we are happy to facilitate and coordinate if there is anything that need to be shipped around to the other side of the country. So as I said again, as much little help is really needed at that end, and health is very important part of the community, and if Fulcrum Aid can support the country with little things, that will be really highly appreciated for us.